everybody? It's me, San Martin. And guess what? I got another special guest that you're going to want to go ahead and wait to see and find out what she has to say. But you're going to have to wait for it because I like to start like this. Boo, boo, boo. You know, whenever you start pressing buttons around here, I swear I don't have no chill button. That's what I like to say. I have no chill button when it comes out of buttons. But guys, as you have read in the, you know what? I forgot what the heck it is. What? In the comment spot or the posting spot, it's talking about a new dentist here locally in town. And currently, I have the number one in lead. Well, you know, I think it's the right hand woman, left hand woman, all around woman. Without further ado, tell everybody who you are and what makes you famous today.
Well, my name is Gina, and I am Dr. Curtis's assistant, and I'm also his brand manager. Mm-hmm. And I'm here to talk to you about Dr. Jason Curtis.
Oh my gosh. Okay, so this is a cool thing. Whenever I end up getting involved with anybody that's here locally as partners and as business friends, business acquaintances, whatever you may want to call it, we actually want to talk a little bit about exactly what they do for the community and how they actually make a difference in our community. But the best part about it is that they are willing to go ahead and take on new patients. So that's the number one thing. We're product awareness. And if you guys need a new dentist, there's a way to go ahead and get involved. Okay. But go ahead and tell everybody a little bit about what Dr. Jason Curtis is all about.
Well, as you know, he just bought the practice last fall from, it's right across from the rodeo grounds on Fair Street.
Yes. How was the 4th of July?
Yes, and our parking lot was packed. Everyone used our parking lot for parking.
I would have definitely been throwing flyers on their windows, like, you guys better check it out. So tell everybody a little bit about what his whole goals are there, what he does as specialties, and kind of what you guys do that nobody else does.
Well, you know, Dr. Curtis is just fantastic. We have the best patients. We've been doing great things since he bought the practice. He really prides himself on seeing one patient at a time, and he's gotten on such personal level with everybody. We're having so much fun. The patients come back a few months later, and he remembers things. It's amazing. He remembers all about them, what they do in the community. But we're there for all the patient's needs. We see comprehensive care. We do emergency visits. We just take care of everybody that needs us.
That is so amazing. You know, I'm going to go ahead and just answer this question right now. Facebook user, we actually have like those little first, if you are a new client or a new patient, we have something for you. If you're interested in taking it, just DM us right now at the Prescott Times Facebook page, or in the bottom of the screen right here, you can go to the JasonCurtisDMD.com or go to the Facebook page and message them.
It's Jason A. Curtis, actually. There's an A in there.
Oh, there it is.
Yep. Jason A. Curtis, right DMD.
You're scrolling right here, guys. Yep. So if you want to go ahead and message them and get in there, just say that you saw it here on the Prescott Times and just to see what happens. Yep. But with that being said, okay, so the cool thing about Jason and Dr. Jason is that he has a lot of good people that are working with him. You being one of them, you're the spontaneous, spunky one, and obviously he was supposed to be here today, so he brought the next one in line, obviously. But I really think that it's because he thought that you could do better than him.
Yeah, well.
Just kidding, Jay. Just kidding, Doctor. We don't want to put that out there.
He's going to watch this later.
I know. He's going to be mad. He's going to sock me in the stomach. Just kidding. He's not like that. No. He's actually a really good man, and he's doing a lot, and he's being a part of the community. And that's the reason why he asked us to go ahead and be on top of the team. And you know what? I think personally with people like that being in our community is a very, very big deal. So tell a little bit what you are doing to kind of like get new patients for the community from the community.
Well, we've been doing a lot. We sponsored a lot of local community events. We've done the Wheelhouse, the sports complex out in Prescott Valley. We're the official dentist there. We've done the Relay for Life, some classic car shows, and a couple other local events. But we also run a lot of raffles and campaigns through our office, where people want to come in and schedule a new patient exam and x-rays. We do give them raffle tickets, and we've given away iPads. We've given away what do you call them? The earplug things.
Earbuds.
The earbuds, yes,
Earbuds.
earbuds. We've given away all kinds of fun things. Sonic Cares for the month of August. The new campaign coming up is we're going to be giving a family 4-pack entertainment package to the picture show up there at Frontier Village.
Nice.
We like to give away things that are going to involve the local community.
Yeah,
so
it's a beautiful thing, and I mean, it's not just to say, "Hey, come and get your teeth cleaned and examined." It's actually saying, "Hey, you know what? We are willing to go ahead and do and go far and beyond what others are doing." I mean, especially when it's time to go ahead and gain new customers.
Yep.
And Facebook user, I don't know who it is that's messaging right now, but I'm telling you, there's all these great incentives. And if you are actually a patient of Dr. Curtis's, what is it? Are you guys still running like a referral program?
Right now we are. We always give a special little surprise to the patients that refer. It changes a lot, but we do give back. So whenever someone does refer a patient to us, we'd like to do some form of a credit or a compensation or something fun for them. We do reimburse them for that. But also when somebody gives us a patient, we take extra special care of those patients.
Yeah.
We like to say, hey, we're friends with your so-and-so. Let's take good care of you. And we go out of our way to make everybody happy. So that's amazing. To me, that's more important than a gift.
And to me, that's very important to go ahead and bring like-minded individuals in our community that is willing to go ahead and actually be that person in our community. How we do it over here at the Prescott Times is we actually really love to go ahead and bring people to the table that is willing to go ahead and give the next best care that it would be to my grandma, my mom, my sister, my brother, my dad.
Yep.
I mean, those things are really what matters here in Prescott, Arizona.
And that's what matters to us. And I have to say, I mean, like our patients actually become our family, and we sit there and work all day long and all I hear is laughter down the hall. That's all I hear is laughter. I mean, of course, patient care is priority to us and their dental needs, but so is fun and having a good time when they're there. And,
Right. I don't know how many people like to have fun going to the
But
dentist,
you know what? I can't tell you how many people will tell us on the way out the door, we had fun. That was fun. Let's do it again.
Let's do it again. I remember like, you know what? I'm going to go to Dr. Curtis's spot to go ahead and have a little bit of fun.
We do. We laugh. We laugh. We have a good time.
That's so funny. Okay. So, one of the things that Dr. Curtis specializes in is a couple of things. Tell them a little bit about some of the things that you guys do at the office.
Yes, we do. We do oral surgery. We do but mainly it's cosmetic. People that don't feel confident in their smiles, people that don't like to smile. We really pride ourselves, and the most rewarding thing of our job is to help people smile. We love to pass the smile along. It's contagious. If everybody smiles, then guess what? We have
Okay, so we got another question right now that is actually a really good question. Do you have a price sheet, like a menu?
If you do visit the website, everything is on the website. We have links to appointments. We have information on the staff. We have a wonderful staff. Read all about us. We have little tidbits on everybody. We have everything you need right there on the website. There's links to go directly to the office where we could call you back and answer any questions you have. But yes, we do have all that on the website. If there's not an itemized price list, feel free to call our office. We could certainly get you in and answer any questions you may have.
Yes, most definitely. Let's see. What is this question right here? Our family dentist in Los Algodones and Yuma, Mexico, basically.
Yes.
Your family dentist or our family dentist? Anyways, you could have a family dentist right here in Prescott, Arizona. So you don't have to travel all the way down to Mexico for those little deals that you're going to get out there. But at the same time, guys, this is a very big deal because this is something that is very good for the community, because you know what? Sometimes the dentist can't get you in for a few months. So what is the turnaround if somebody were to make an actual appointment today?
We always have blocked off time in our schedule for new patients. Everyone has a dental issue. Everyone has something, a concern. We don't like to put them off. We want to address everything soon. We could normally get somebody in within a week. We don't have it. We save blocks on our schedule just for that. So we normally get people in with a week, like I said, and we're there to give you options. There's all kinds of options to fit your needs. There's no pressure of doing any sort of treatment. We always make sure that you understand you could do this, this, or this, and then you decide what is best for you.
Do you have any like special programs that if somebody can't afford, dentist work
We
in
do.
general, what do you guys
Yeah.
have in-house?
We have two different companies that we actually are linked. We're partnered up with. There's two companies that you apply. So I think one of them is 0% interest for the first year, so you have a year to make them payments. But we do have financing available that they could do. We're partnered with these companies for that reason.
Dude, that is amazing because a lot of people need a little bit of assistance when it comes down to it. I would tell a little story about my nephew. I think I shared it with you, but he comes to me, he goes, Theo, which is uncle. I need my tooth taken out of my mouth. And I guess this is what do you call those ones that you come in, wisdom teeth? And I said, all right, cool. He goes, I was like, how much? He goes, $100. I was like, all right, cool. I got you, man. No worries. He calls back, goes, Theo, it's gonna cost like $600. And I was like, whoa, that's a little bit different than $100. So this is, obviously, thank God we had the money in order for him to go ahead and get that tooth extracted. But those things happen, and it does happen. And so if you guys need a little bit of support and a little bit of help, this is the right place to go. And I'm telling you what, guys, it's a pretty big deal to go ahead and have a new dentist in town, and especially when they're wanting to go ahead and have patients. But at the same time, guys, he has a lot of patients currently already, but he has enough room to grow in order for you guys to come down and get it.
Yeah. It's amazing, though, how quickly, even though he bought the practice in the fall, how quickly he has become such an established member of the community. People, once you meet him, people really come to respect him and appreciate what he has to bring to them.
So we have a question right here. Obviously, I think it's Dan Glenn. Dan Glenn is asking, can you go ahead and get an extraction same day for under $100? Probably not.
Yeah, we could do the same day.
Yeah,
we could do the same day.
But the thing is that if you think about it, from Prescott, Arizona, all the way to Algodón, Mexico, and not only are you going to be paying for the actual cost of the gas and your vehicle wear and tear, but also by the time you get there and come back, it's the equal value. To my perspective, if I was right there on the border, it'd probably be like an idea. But at the same time, I think that you're going to have to do your due diligence and also do your work in order for you to find that out. But at the same time, it is one of those things that you guys go ahead and do and try to check out. With that being said, what is a good way to get in contact with you guys?
Sure. Well, they could call us at the 928-776-0606, or again, check out the email if it's still or the website if it's still scrolling down there.
What was it? 928?
928-776-0606. But I do want to go back to that extraction same day real quick. I want to tell him that there's a range of fees for that, but we will do a no-charge consult. We do offer a no-charge consultation. So if you come in the office and we take an x-ray and tell you how much, it is a no-charge consultation.
Nice.
So,
and if you're a new customer or new customer, I think it's client, right? Patient. What do you guys call them?
Patients.
Tooth provider. You give me your teeth.
Yep.
Please give me your teeth. Is there something like a special program for new patients?
Yeah, we do offer right now for patients that come in to want to be established. We do have a great offer right now. We do a cleaning, exam, and a full series of x-rays for $150, which is more than 50% off of what it would be normally.
Oh, wow.
So it is for $150. Just come on in and we'll look at everything and let you know what your dental needs may be and go from there.
Yes. It says, thanks, guys. Dentistry is tricky for those without insurance and living paycheck to paycheck. Love the scaled range pay. Right on. I think he went to the website to go check that out.
Yep. It's all on there.
So. Yeah, this is a very big deal, guys. And so obviously you got to take care of your teeth. I got a little funny story and I'll go ahead and share with you guys. So here I am, 44 years old. I think I will be 45. I don't know. I'm going to stop my age at 43 here because counting more than yeah, I'm just trying to say no more counting. But I never went to the dentist. Yeah, it's one of those moments, guys, where I'm like, wah, wah, wah. Anybody that's in the dentistry field, there's gonna be like, what the freak? But it was good because, needless to say, I did go and I didn't have too many problems with my mouth, so I was like, oh, thank goodness. But ultimately you got to take care of your mouth. And
Well,
this year was the first time I actually went.
And
so.
in fact, I just read, and I'm not making this up, I just read that it's over 50 to almost 60% of adults don't go to the dentist as recommended. I just read that.
Yes, well, I'm pretty sure it's because of all the pain that they will put you into. But when I went, it wasn't that bad.
I was going to say, we don't. It's amazing how many patients leave our office saying, that wasn't as bad as I thought. So it is.
Lonnie, if you don't have teeth, they can actually make it for you.
Yes,
we could
do that too. And we have implants that we could do something from.
I'm telling you, Lonnie, you can come back with a new grill, be a new person, my friend. If you don't have teeth, we can go ahead and find you some teeth. Yes. I'm pretty sure we could do
that.
That
is what we're here for. That's what we're here for. You have to eat. You have to chew, right?
He's like, I want to be doing, what do you call it? What are those things that everybody starts making now in the blender?
Smoothies, protein shakes. Shakes.
I like acai bowls.
No, you want a good steak.
yeah. You want to go ahead and have a little bit of meat.
Yeah.
You'd be like grinding everything. I don't know how it would be to have no teeth. So you guys, before you end up in that position that Lonnie is in right now, I'm telling you what, you're going to have to go ahead and figure it out, my friend. Get some teeth in that mouth because you're missing out on some good meals.
Yeah, that's right.
Let's see. Do you offer gas for nervous patients?
We actually have an oral sedation or gas. We offer an oral sedation, which is a little bit even better than gas.
I'll be like, here, I'll hook you up real quick. This is good. I mean, if you guys have any more questions, we're here to go ahead and answer it. This is an opportunity of a lifetime to go ahead and get involved and ask some questions before you even have to go to the dentistry. If you don't want to ask any questions right now, be free to go ahead and go to their website or even message them on their website page, and they will go ahead and answer you back.
But in all kidding aside, that sedation, we do have oral sedation. We have all kinds of different options to make the patients comfortable. That is one of our top priorities is patient comfort.
Yes.
So,
and I think that is an actual a great thing. I mean, my experience with the last dentist, it wasn't the greatest experience, in regards to some things. But I tell you what, when you actually think about how comfortable you need to be in order for you to kind of like sit in that position, it's a very vulnerable scenario. Like I'm just sitting here, I'm just like, I have no clue what you guys are doing to my mouth. I have no clue why in the heck you're grinding.
It's the fear of the unknown.
Yeah, and I mean, they explained it to you, but you know what? You got to put it in a layman's term, And so, needless to say, I think that finding you guys and actually having you guys on the team and being able to be a part of something that is not even in my field, to actually understand some of the ways that you treat the community and the people in the community. I think this is a really awesome thing.
Yeah.
Yes, they do implants, Lonnie?
We do implants, and that's one of our specialties. And I tell you what, I've been doing this for over 30 years. And the skills that Dr. Curtis has shown me, I will never retire from my job again. Never leave until I retire. His skills, his oral surgery. I mean, he is amazing what he does. And implants, it's just amazing to watch him every day. That's what he specializes in.
See, this is what he says right there. I think it's still Glenn. Oh. He says that if you're not comfortable, you're less likely to go back to the dentist. And I think that's
very true. That's we got pillows, we got blankets, we got everything.
We got gas.
We got anything you want.
We get you comfortable. If you guys want a little cocktail, just kidding.
No.
Cocktails. Okay, so with that being said, one more time, tell everybody how to go ahead and get a hold of you.
Okay, so the phone number, again, just call the office, 928-776-0606. You could visit our website, jasonacurtisdmd.com, or we're on Facebook. We have Instagram, we have Facebook. Social media's out there. Anyway, just all you have to look up is Dr. Jason A. Curtis, DMD in Prescott, and you'll find all kinds of ways to check us out.
Yeah, and if you guys wait for this thing right here to scroll and take a screenshot, you'll have all that information. And screenshot now.
Okay, go.
Oh, man. With that, I'm so happy that you're here. I think you did a very good job for Dr. Curtis, and I think that he's going to be very amazed by your calmness that you had. And he goes, it's all about the lights. We heard about that story, Jay.
Don't tell him this.
I got you in trouble, Gina. Let's see if he actually watches it till the end.
This is why you sent me this time,
All right, guys. With that, I am definitely out of here. We got things to do. It's late afternoon.
And we're looking forward to meeting everybody.
Yes.
So bring them in.
Yes, come on in, guys. You know, there's going to be some special deals for those that are actually a patient and also the new patients as well.
Yep.
With that, I'm out of here. We got things to do.
Yep.
Like, go home to our families.
Yes.
I'll talk to you guys later.
Good night.
Bye-bye.